All right, Kim, thank you. Well, as we just heard, stroke is a leading cause of death for Americans. And while risk increases as we get older, strokes can and do occur at any age.
Yeah, Dr. Jennifer Burkett, a neurohospitalist at SSM Health, joins us to expand on that. Thank you so much for being here.
Thank you for having me.
Such an important topic, so we want to talk a little bit more about what we just heard. Let's talk about those warning signs and what we need to watch out for.
Yeah, so strokes happen very suddenly, very quickly. So it would be sudden onset of speech changes, whether that's slurred speech or trouble getting your words out. You can also have weakness on your face, weakness in your arm, sensory changes, sudden onset dizziness, really severe nausea, vomiting. Really any acute, happens quickly, sudden neurological change is a 911 call and go to the emergency room.
And don't be afraid to call 911.
No. I would say have a very low threshold
Yes.
to call 911 and if you're worried that you're having a stroke.
Yeah, and with a stroke, time is of the essence. This is something people really need to be calling 911, getting an ambulance instead of just, driving to the ER.
Absolutely. For a couple of reasons. One, if you come in through the emergency room, through EMS, or through an ambulance, the stroke team is activated quickly. So I will meet you in the emergency room. I'll do my stroke assessment. We'll get the scans as fast as we can. It's nice to have a little bit of time to prepare. And then the second thing is we have treatments for stroke. Those treatments are time limited. So one is a clot busting medicine. It's called Alteplase, or we use Tenecteplase more commonly now. And then we have a procedure that we can do to go in and take a clot out. So whether or not you're a candidate for those procedures or treatments really depends on when your last known normal was, and it's really when you were normal. So it's really important to get care quickly because of the treatments that are available.
And it truly can happen at any age. My son was born with a heart defect, and when he was a baby in the hospital, he had a stroke when he was having some complications.
Oh, I'm sorry to hear that.
And he's okay now,
Good.
but it's truly incredible. And I've known some people in their 20s who have had strokes, so you really can't underestimate if you're feeling these symptoms that it could be something serious.
Yeah, young, old, if you feel like you're healthy, strokes can happen for a variety of reasons. They definitely happen more commonly in the elderly population, just because it takes many years for the risk factors of stroke to kind of catch up on us. The tobacco use, high blood pressure, high cholesterol, diabetes, those are more the traditional risk factors for strokes. But then there's other strokes in younger patients who can have dissections or other causes of strokes, hypercoagulable disorders where their blood is thicker than normal. So yeah, any age, sudden onset of those neurological symptoms definitely need to be evaluated emergently.
What can we all do to lower our stroke risk?
Just try to live a very healthy lifestyle. Sometimes it's easier said than done, but I would recommend frequent going to the doctor, getting your annual visits, keeping alcohol at a very minimum or none at all, cutting back or quitting smoking. Smoking has no benefit and is probably the best thing that you can do to help reduce your risk for strokes in the future. So if you do smoke, to work on stopping. And then manage chronic diseases. So manage diabetes, high blood pressure, high cholesterol. And really that's the best that we can do. And just live a healthy lifestyle, diet, exercise, maintain a healthy weight.
All good things we all should know.
Yeah.
Well, really important information to have. Thank you so much for being here and for sharing today.
Thank you. Thank you for having me.